Hello everyone, this is Dr. Ian Cyrus. My clinic is located at 321 Morris Road in Fort Washington, PA. And this clinic is the Acupuncture and Oriental Medicine Center. So, thought I would spend a few minutes and talk a little bit about the use of electrostim within the context of our medicine. Now, if you look at the board here, it says milli-current versus microcurrent. What people don't realize is that there's a huge difference between the two current modulations. So, milli-current is usually designated by small m, large A, and microcurrent is mu A, okay? Now, let me plant this image in your head. Using milli-current is like aiming a fire hose at a garden. So think about what that would do. As opposed to microcurrent is like turning on a sprinkler system. Get it? All right. Now, let's take it a little bit deeper than that. Milli-current is totally disruptive to cellular function, and that includes cell transport and respiration, okay? It's totally disruptive to the cells. Even more so, it literally fries the mitochondria in the cells, which, as you know, the mitochondria are these organelles within the cells that produces ATP, which is the smallest molecule of energy that your body needs in order to function. It's responsible for driving protein synthesis, which has to do with healing and recovery, all right, and growth factors. As opposed to milli-current that would literally destroy the mitochondria in the cells and the cell's ability, to produce ATP, protein synthesis, and growth factors. So why use one over the other? Well, historically, milli-current has been greater availability, okay? And it's cheaper. So there you go. Now, let me further define microcurrent. One microcurrent unit is 1/1,000,000th of a milliamp. It's small. It's almost like a homeopathic dose of current, okay? Not only that, the electrical potential across the cells and the electrical potentials moving through the body is similar to microcurrent. Using milli-current is like raspy. It's like sandpaper to the nervous system, okay? So why milli-current is used? It's because it's for pain management. It doesn't, to me, and I admit I have a bias towards the use of microcurrent. To me, it's like, why use it? Because when you look at how it functions on a cellular level, it doesn't make sense. The acupuncture channels and meridians that we use in our medicine, if you were to measure the electrical potentials of these meridians, it's closer to microcurrent. So microcurrent, mu A, produces ATP, growth factors, protein synthesis by 300 to 500%. And it's important to keep that in mind. Both of these types of current will manage pain according to the gate control theory by Milzak and Wall when they came up with this gate control theory in 1965, this whole concept of gating and how pain is transmitted to the brain, okay? It blocks the signal, the afferent peripheral fibers, from sending the pain signal to the brain. And so when we do acupuncture, for instance, or use electrostim, there's competing signals, and one wins over the other, all right? So both of them manage pain. But as I said before, milli-current destroys the mitochondria's ability to produce ATP, growth factors, and of course protein and synthesis. It disrupts cellular transport and cellular respiration, as opposed to microcurrent, which is 1/1,000,000th of a milliamp. It facilitates the production of ATP and growth factors and protein synthesis by 300 to 500%. It also manages pain and inflammation. All right, and often with respect to managing pain and inflammation, there's always these inflammatory cytokines that are present. For those of us who do a lot of like trigger point work, for instance, these trigger points. It's been noted through research that there are inflammatory markers that are present when these things are active, like interleukin 1 and 6. Post-treatment, those levels drop, so healing can occur. Okay? Now, here are some things you need to know about using microcurrent. Microcurrent is delivered at sub-threshold levels, meaning it should be below your patient's perceptible range. That is, once you connect the electrodes or the leads to the whatever unit that you might be using, you turn it, once you set the frequency, you turn the intensity up until the patient just perceive it, and then you drop it just below that perception. So it's unlike milli-current, where there was this constant mechanical action is felt and seen with the muscle twitching away under the use of milli-current. And that twitching away muscles is really not helpful to the muscles at all, as I've pointed out earlier. All right? Also, what the research have shown is that any therapeutic effect derived from microcurrent, okay, diminishes after 500 hertz. So typically, the whatever frequencies that you're using should be somewhere between 0.05 and I would say 500. But for most of us, like me, I keep it around 300. I don't go above 300 hertz whenever I'm using microcurrent. Okay? So keep those things in mind. The higher frequencies of microcurrent, it's been found that treats more of inflammatory disorders like a painful swollen knee, things like, I would say, any area where there is a tremendous amount of inflammation, whether it's the knee, the elbow, the shoulders, wherever, okay? So the higher frequencies are important. Now, some of these units, when you purchase them, they may only go up to 100 hertz, or 200 hertz, or 292 hertz. But you want to purchase a machine or a device that will take you through the full spectrum of the specs of microcurrent, which is somewhere around 0.05 hertz to 300 or even as much as 500. This way you have some flexibility in how you use microcurrent. So the higher frequencies, again, are for like inflammatory problems. The lower frequencies, more for pain management. Okay, so you may start out a treatment at about 300 hertz for about 5 or 10 minutes and then drop it down to like maybe 10 hertz for the remaining 20 or 30 minutes. So that's kind of how it's used. But I just wanted to take a few minutes and give you my 2 cents worth on what microcurrent is versus milli-current. Thank you.